Life members, this is Dr. Rob Vanbergen, and I'm back with another Monday 10-minute training. This week, we're going to be talking all about cellulite, not to be confused with cellulitis, cellulite. And we're going to be talking about how to treat it using microcurrent therapy. So, to begin, what is cellulite? I'm sure you already know, but cellulite, in discussing kind of what it is, we'll be able to kind of break down how we can help it. Cellulite is a very common, harmless skin condition that causes lumpy, dimpled flesh, typically on the thighs, the hips, the buttocks, the abdomen, and the condition is most prevalent in women. Usually it can hit pretty heavily after childbirth, for example, where you've had like weight gain and then rapid weight loss. So there's so many different defining factors in there. You can only really see mild cellulite if you actually pinch your skin in an area where you have it, such as your thighs. Cellulite that is more severe will make the skin appear rumpled and bumpy with areas of like kind of like peaks and valleys. Many people try to beat them all, and this is kind of why. Little is known about exactly what causes cellulite. It involves fibrous connective cords that kind of tether the skin to the underlying muscles with the fat laying in between. And as these fat cells kind of accumulate, they push up against the skin and the long, tough cords kind of pull down. And this creates an uneven surface on the skin. And this is like the dimpling where you can have the valleys and the dips, right? An easy way to imagine cellulite actually functioning is it's almost like a hernia when your muscles rip and the organs pop out, but this time the muscles are tight and the fibrous tissue is tight and it's squeezing the fat out, which is creating this strange appearance that people just really don't want to have around. Now, there is no magic cure for cellulite, but microcurrent therapy can really help to reduce these dimples, and this can help give your skin a more toned and smooth appearance. The first thing when dealing with this that I would want to deal with would be the liver itself. The liver is the organ that governs your muscles and your connective tissue, and very often improving the health of the liver is going to make strides towards helping reduce the cellulite in general. So treatment can involve treatment over the liver itself, or you can even look into treatment of the liver meridians. Often I find that it's enough to just go straight to treat the liver. So with any of these devices, what I would do is I would switch to a stimulation mode. So with all of our machines, you've got blue stimulation. With the Pinnacle, you've got multiple different ones. If I were to be picking one, blue stimulation is definitely my preferred mode for most people. Blue stim in the Pinnacle, blue stimulation is the last mode with the blue light on the Evolution, and it also has a blue light on the Genesis as well. So everyone will have access to this. You're going to set the power to a comfortable level. So to do that, you turn the device on, you place it on the liver, which is underneath the right pectoral area, and you're going to adjust the power until you can feel it. You can use any probe, you can use the back of the device, but you want to be able to feel a gentle tingling. Once you've done this, you're actually going to move the device or the electrode over the area, painting it and getting rid of any sticky spots. Remember to adjust the power. You want to hold the plus button down, not press it one at a time. You want to be able to feel a tingle. Once you've painted over the surface and you've worked out any stickiness, which are the active zones, then the liver component of the treatment is done. But beyond the liver, we can try to look at breaking up the fibrous cords that are actually restraining the muscles. Remember, as the muscles are restrained, they're pushing the fat cells out, and that's creating what we know as cellulite. So for this, I would recommend using something simple like Sana Deep 77 if you have a Pinnacle, and following up with blue stimulation. It really doesn't have to be much. You only need to do 3 minutes of each. Or 6 minutes of blue stimulation if you are lacking a Pinnacle. You just want to paint the area daily and work to loosen things up. So keep the treatment short, keep visiting that whenever you can. It's a nice short treatment process. It's really not a huge amount of commitment. Of course, if you have large areas of cellulite, you've got cellulite in different areas of the body, you may want to pick and choose, focus on an area plus the liver. Don't try and do everything at once. Pick the worst spot for you, the area you really want to work on, and work from there. That's going to provide you with the best results because you don't want to commit a huge amount of time to treating all over the body when the liver may be providing a lot of the benefit. It just might take a bit more time. So really do focus on what it is that you're looking at as a priority and add that in with the liver treatment too. If you're getting no results trying to break everything up with blue stimulation, you could try something more subtle like 77 hertz and see if that makes a difference as well. But ultimately, blue stim is probably the strongest mode in this case. Okay, so that about wraps it up for today's training. If you have any questions, please let me know in the comments below. Thank you so much for joining me today. I look forward to seeing you next week for another Monday 10-minute training. Take care, everyone. Bye-bye.